So let's talk about radiology negligence. Radiology is a fundamental aspect of medicine. Doctors rely on radiologists to guide their decision making, and it's important that radiologists get it right. So the kinds of things that can happen with radiology is, for instance, a radiologist is asked to do a test. Patient comes in suffering a car accident and some trauma to the chest, and they're looking for a particular problem that might be associated with trauma. They read the exam, there's no trauma-related injury, but on the exam it also shows a mass in the lungs, and the radiologist doesn't notice it or mention it to the emergency room physician. As such, the report is written, says there's no trauma to the internal organs. 2 years goes by, the patient starts having symptoms, and lo and behold, you see 2 years ago on the original trauma CT scan, there was evidence of a mass which could have been caught and saved the patient's life had it been disclosed to the ER doc. Another aspect of radiology malpractice is that the radiologist it has to inform the physician and guide their decision-making in a way to make sure that the treating doctor is fully aware of conditions that may exist in the patient. So, for example, the radiologist can write a report, make a note about something that's critical in the exam, but he doesn't follow up that report with a phone call to the physician. The physician, being busy, may not read that report as closely as he or she should, and what happens is that exam falls through the crack. There was a critical aspect of that radiology exam. The doctor doesn't make a personal phone call, which is what is required to do when there's a potentially life-threatening condition. And as such, there's a delay in diagnosis as a result. So it's important for radiologists to follow up and make sure that they communicate life-threatening matters to the attending physician. And that is a way that radiology malpractice can be implicated in medical care.